Hey, everybody. Welcome to Red Carpet Healthcare Solutions Private Practice Podcasters. I'm your host, Dr. Ryan Molli, along with my co-host,
Travis Buzzell.
So before we even get started, I urge all of our listeners to like, subscribe, make sure that you share this with all of your social media buddies and followers, and leave comments, leave suggestions of people that you'd like us to have on the show, and critique us. We're up for it. We'll respond to your comments, suggestions, and just appreciate you watching. But today, very special guest, one of my very, very good friends from years past, orthopedic residency. We were partners at one point. We were co-residents at one point, and just very good friends.
Awesome.
You've had a little bit of a chance to kind of meet him for the past 10, 15 minutes or so before we went on the air here. Dr. Blake Miller. So welcome.
Welcome.
Thank you for having me. The whole concept and the dogma of this micro trauma theory just didn't make sense. And so I started really kind of digging into the literature of what is happening and why else would we have this, just all this arthritis and osteoporosis and high blood pressure? Because you don't see these things in isolation. I mean, people don't come in with just arthritis. They usually have, diabetes, or they have insulin resistance, and they have high blood pressure, and they have all other diseases that you can't separate these two, because people are not just coming in with isolated arthritis. They're not coming in with just isolated high blood pressure. They're not coming in with just isolated hypertriglyceridemia. They're coming in with a collection of symptoms. And then you have to say, well, all of these have to happen. They have to be happening together.
Blake, what I would like to ask you, I'm obviously an orthopedic surgeon. You're an orthopedic surgeon. Travis is not. He's way smarter than us. But what is functional medicine for all of our listeners out there? Can you give us like a pretty easy to understand explanation of that, and what your goals are with functional medicine?
Yeah, functional medicine is colloquially, as we talk about it, is the root cause medicine. So what causes these diseases? What's driving a lot of these processes that are occurring?
The things that you're saying make so much sense, but it's kind of like what you're saying too. It's almost like, and I'm not trying to play the conspiracy theory guy here, but it's like the system now is set up to, we're going to pay for those meds for you, and we're going to provide this service to you. It's like, we're going to do all these other things for you. And it's like, if you just stop doing all of those things and walk more and drink more water and eat more like
whole foods.
Yeah.
Right?
It's take away the preservatives, eat whole foods, and get out in the sun once in a while and take your shoes off and walk in the grass. Like, things might get better.
Yeah.
And people, you know what I mean, aren't getting less expensive, but it's like, well, they can maybe if you start a garden, or, I'm not suggesting that you start a farm, but there are resources and things that
thought about it.
I'm sure you did, but you're a little different. So no, but it is, all the things you're saying make so much sense and they're important, but it's like helping to educate people to, like, I guess, kind of like buy into the things that you're saying, right? Because it's like, because forever and ever, we as like a society has been like, well, you know what? No, you need to do therapy on that knee for 6 weeks before we can even consider approving, an authorization to have surgery. It's like, well, we know that's not gonna help it, because, they pay for it and they go through the whole process. And does it help? No, and they end up having the surgery anyway. So it's like, we've been kind of programmed to say like, no, this is what you need to do. I can fix this problem that we've been talking about for 50 years by eating better.
Yeah.
You know what I'm saying?
Right.
Yeah.
Well, and that's the thing. And then you have that's the other side of the coin too, is that the federal government is subsidizing the fake food. So it's making it cheaper. So it gives you the illusion that, I can get a lot more, because they have lulled people into believing that the calorie theory is the only thing that's appropriate. So you're like, I just need to lower my calories and then, I'll lose weight. Well, that's never been the case. Trying to give somebody a drug to treat a distress signal is not the way to do it. And so I don't think the body's making a mistake. I think it's doing exactly what it's supposed to do. And so it's just.
Can I expand on your analogy earlier about the the gas light going off.
Yeah.
Well,
Yeah.
what's even taking it to the next level is the hospital system and whatever you want to call it, the American Heart Association, all the food pyramid, everything.
Mhm.
It's like, well, we'll shut the gas light off, but let's also just put diesel fuel in your gas
Yeah.
engine,
Yeah.
right?
Absolutely.
I mean,
Right.
because
Right.
our bodies are screaming at us with symptoms, whether it's hypertension, whether it's dyslipidemia, whether it's hyperinsulinemia, everything, metabolic disease, and we are doing the exact opposite of what we really need to be doing to
Yeah.
help
I
our
mean, there
car
was
engines. Wow,
All right, I am starting to get a little freaked out now.
it wasn't take much for you though. I mean,
No, but it's I don't know. Like the more and more I listen to this conversation, Peter Attia. I mean, there's some other guys like Gary Brecka. They're just promoting kind of exactly the things that you're talking about. And
right. And that's why I only take cash, is because one, you have to buy in. You have to have skin in the game. If I ask you to do something, you're like, well, crap, I spent a bunch of money and I better do it. So I will not be successful if I don't get your buy-in. And the problem is a lot of people are saying nothing with mid-levels. I think they're amazing. They do very, very good work. But they have convinced everyone, the public, primary care. It's like there's no difference between a nurse practitioner, PA, or a physician, and because they all think the same and they all do the same thing. That's the problem. I'm a physician. I should think differently. I should be able to synthesize information at a much higher level than a PA or an NP, because I have much more education in it. So that's what I need to do, and that's the important part of being a physician, is thinking outside the box a little bit and saying these things don't make sense.
well, Blake, it's always a pleasure talking with you and listening to you, and you invigorate me in so many different ways. I mean, like you have for the past 10 to 15 years.
Yeah, and I appreciate you having me on.
Appreciate it.
Thanks,
Yeah,
Travis.
I really appreciate the conversation, and we'll be in touch because I got some stuff I got to get worked out, and I think I found my guy. So.